Welcome, everyone, to the Growing Your Dental Business podcast. This podcast is where we explore innovative strategies for building a thriving dental practice. I am your host, Jacqueline Hurley. I am also the director of the eAssist Consultant Network, where we talk with dental consultants and explore ways to help the dental community. Well, today we are going to discuss how to create a culture of belonging and safety within your practice, and how having a diverse team increases team engagement, patient case acceptance, and retention. And my guest is from Charlotte, North Carolina. Her name is Kristine Berry, and she is an exclusive leader, coach, and trainer who helps organizations foster sustainable success by leveraging the power of cultural diversity. So Kristine's middle school experience just kind of affected me, and it's probably going to affect you too. I'm just reading her bio here, and she was scarred by bullying when she was in middle school, leaving her with a painful memory of a metal hand dryer pressed into her back. She survived, determined to find her voice, claim her self-worth, and support others in doing the same. So Kristine identifies as a mama, sister, aunt, friends Joneser, right? A Scorpio with Scorpio rising, neurodiverse, and an introvert. With over 30 years of experience in the dental industry, she founded the Dental Diversity and Inclusion Alliance, which is DDIA. So to help people and organizations achieve sustainable success by leveraging the power of cultural dimensions. Kristine is a renowned leader, coach, and trainer. Companies and associations hire her for her speaking engagements, and she speaks all about diversity. I love your topic, and I'll tell you what, Kristine, welcome. I'm so excited to have you
Oh,
on
thank
the
you.
podcast
Thank
today.
you. Thank you for having me here. I'm very excited to have our conversation.
Oh, good. So let's talk a little bit about implicit bias. And can you explain it and how it manifests itself in the dental field?
Absolutely. So, um, just the word bias itself. So, when you're looking at the word bias, there's two levels. There's conscious bias that we're all aware of. For example, I love chocolate chip ice cream, or I love coffee ice cream, right? So, if I'm at an ice cream parlor, and I'm going to have a bias towards what I like. Certain sports teams, you may like certain colors, right? Or certain ways to drive to work. So those are all your own biases, your own tendencies. And then the implicit bias or the invisible bias, things that I don't realize that I do or I say, I perhaps act in a way that may or may not align with who I am as a person, but it could be more like automatic. So I've heard these stories, I've heard these choices, I've heard these topics about other people, patient populations, for example. And then I may act out on it. And then, unless we as professionals, we as people, as humans, have a reflective and pause and kind of get in that culture that can challenge you to say, did you really mean to say that? Or did you really mean to do that? And that's what the implicity comes in, because you're not really fully aware of it. What we do know, though, that expression, you cannot teach an old dog new tricks.
Yeah.
Not true, not true. The neuroscience, not that I'm a neuroscientist, but the neuroscience does prove that our brains can change, and with neuroplasticity. So habits can become either no longer if they're a negative habit, or we can start doing a new habit, for example. And we know this in dentistry, because when I first started in dentistry, I had to use film. I had to use an old dippity do, from the x-rays. And now we're all digital, right? So we can adapt that way, and we can adapt ourselves behaviorally too.
I love that. I think that's fantastic. So how can a practice evaluate if there is bias amongst their team members, or even with their patients or towards their patients? How does a practice even know if it's implicit, if it's kind of invisible? What are some of the signs that they can look for?
Well, I have to say, and I have said, if you're breathing, you have biases, period. So they're going to be there. How they manifest, how they show up, that's going to be what we can look at. So I always go back when I'm speaking with a practice owner or a company, you goes back to what are your pain points, right? And so right now, a lot of conversations have been around talent, talent acquisition, talent retainment, just trying to have a full team, right? So they can deliver the care that they want to care at the level they want to, be able to deliver it. So that would be an aspect. So if that's kind of your pain point as far as with from a bias standpoint or a culture standpoint, and I want to say it's culture is a word that's used a lot, but really, I mean, dental hygienists have a certain culture, right? Dental assistants do. We always hear the front office from the back, right? Certain social groups have different cultures. If you play pickleball, that's your pickleball culture, right? So
Right.
culture is multifactorial between two people and as well as within a group. So we can have multiple dimensions of cultures going on in a practice, and that's also where some of the biases can show up. Specifically, as of late, it's been working with office managers. I love office managers. I'm not picking on any office managers, but we're working with office managers on the interview process.
Okay.
Because what we had found in the past and what has been happening is that they weren't aware of perhaps some of the languaging that they used in front of candidates. They did not necessarily were trained on using a rubric or the same questions for each candidate. So each candidate coming in for a position, they should have a standardized questions for all. Because what can happen is that if you see a resume and they went to the same school you did, or they know someone who when you're in that interview process, you get more familiar. You get
Okay.
more casual, right? And because we're humans and we get nervous, but when after the interview is done, when we're going back in our brain, reflecting on who's the best candidate, the bias is going to be the relationship bias. That's going to be a lot stronger because we want to hang out with people who we like. We want to hang out with people that we know. That's just our default. Likes, like. So if I remember a candidate and oh, they went to that school, we had a great conversation, in my brain, I'm thinking they're going to be a culture fit for our practice.
Yeah.
And that is exactly where you can pause yourself and say, well, do I want a culture fit? Number one, or do I want a culture add? Because a culture add is looking what you do not have in your current team members, what skill sets, knowledge, skills, and abilities, and what you need to be hiring for. And that could even things out a lot more. So it's just kind of slowing down the process a little bit, making it more equitable across everyone. And that's it's not a lot of work in the forefront because once you have those systems in place, that's when it's just, the rinse and repeat when you're going through that process. So I hope, was that helpful, that
Yeah.
example?
Yeah. No, I think that's great. I understand exactly where you're coming from. So,
Yeah.
it's better. Obviously, you want to hire a diverse team.
Mhm, mhm.
Like if you have the exact same culture, then you probably are wanting to service that exact same culture as patients as well, right? The
Yeah.
goal is to
Yeah.
be able to offer services to a diverse patient database.
Yeah. Well, I mean, the thing is what we need to look at, and sometimes my background in dentistry too is practice management consulting. So a lot of the systems were new patient acquisition as well. So we would do an exercise that you wanted to create your patient avatar, right? Who is your perfect ideal patient?
Yeah.
And a lot of times, again, that was in the person that was the person that you like, right? Or you're going to be most familiar with. And then what happens 10 or 15 years later, your community changes. So really you want to take a look at what the demographics and what the population is of your community, the 5 to 7 miles around your offices that patients will travel to see you on a basis.
Sure.
And does your team member make up what it looks like in the community? Or is it, for example, I'm going to just say white, is your team all white, but in your community you have more people of color
Yeah.
or more of a balance. And so when you do have that next position, and this is where my more of a thought partner with practices, where can you begin to look that's outside the normal three things that you always used to look for, right? You always look back to the same wells all the time looking for candidates. You're always going to get the same thing, right? Or if you do the friends and family program, which, go to your hygiene, from a hygienist standpoint, go to your hygienist and say, do you have any friends that may want a job? Well, I may, but they're probably going to be a lot like me, right? So that's not really going to serve your goal if one of your goals is to have and increase the environment. And that's the visible characteristics.
Yeah,
We were talking earlier about, it could be your verbal skills, right? So everyone has different types of verbal skills, and they are needed in for a variety of patients, or the way you think about things. So the diversity dimensions is not just, the visible. It could be generational now, right? We have lots of generations in the dental practice. So do you have a generation bias for age, for ageism? For someone like myself on one end of it, but a lot of the times too, these young adults, these young career people are coming into the industry or attempting to come into the industry, and they're not getting a chance because they think they're too young.
yeah,
So that again, this is not a right or wrong conversation. We're all human. But if you begin to hear yourself in your brain starting to say that or speak that, that's a real clue that there's a bias somewhere in there that you need to peel back and say, am I just projecting this on this young adult and it has nothing to do with his or her, capabilities? So
sure.
that's type of a way you can do that.
That's great. So, what can an office manager do to create a safe space for open conversations about race, ethnicity, and other cultural factors in the dental office?
The educate first, the education needs to come with yourself first, right? So if there's an area that you're not familiar with, from a book standpoint, and there's a couple of resources that I can share with you that are more specifically for how bias shows up in dentistry, how it shows up in treatment option, how it shows up with how we dose out pain medications for certain demographics, right? So there's a lot of research around there as well from the oral health equity space. If you're not familiar with oral health equity, that's something else that you could do a little bit of homework. So this type of work is no different than learning about a new composite material, or learning how to learn how to use a new technology. We have to put a little bit of time in that. But we also just kind of want to take a look at who your team are and ask them. I mean, it's very simple. There's two ways that a lot of us are doing or involved in, surveys. Like, you survey your team members. It's 3 or 4 questions. You can do a Survey Monkey, you can do a Google Doc, you can have them fill it out and put it in a little box if you want to, however you want to implement it. But really, the key is finding out what they want, what are they going, what are they feeling? Do they feel safe? And then follow that up with, again, structured, just like stay interviews. Just sit down with your team member and ask them a series of questions, all the same questions that hit certain categories that you may, again, go back to what your need is, what your, your values of your own practice, and what your value statements are, and what your mission is, and what you may think that you'd be missing. Or you could just do a pulse check. No different than when we're taking numbers, right, from dashboards, and we want to
Yeah.
make sure that all our numbers are in line. This is a pulse check too with your team, and they are where we should start, because they are your team. We need to move away from ourselves from a leadership standpoint, if that
Yeah,
makes
I
sense.
love it. It seems like you would want to do that quite often anyway, just get a pulse on your team and how's everyone's feeling, and if everyone's, feeling okay about the environment they work in every day, about the people they work with every day, those kind of things. So that makes
Yeah.
sense.
It's funny because you probably have heard the word, psychological safety in teams, and that's an interesting dance, because first of all, we all want to be physically safe, right? We want to be able to go into an environment every day when we're working 32 to 40 hours, and we just feel our physical safety. We don't have to walk in there and have any type of anxiety. But
Right.
the psychological safeties too is, can I bring who I am to this office and be fully engaged, or do I have to keep a part back? Do I have to start doing some covering of who I am and what I do maybe in my private life, or who I may be married to, right? Or maybe I don't drive the same level of cars that the other team members do, right? So am I, psychologically safe to be able to be who I need to be? And that can take some time. I mean, that really can take some time. So yeah, starting off with, the question you're asking, and then that's where, not that any third party can help you, support you with this outside of your practice, because if that trust isn't there, if you've had a lot of turnover, if you've had a lot of, maybe some complaints, or just whatever, the issue would be in the office, that you may not be able to get to the real truth unless you bring in a third party to help support you with asking those questions. So,
Well, and it seems like you found it the place to start. So
yeah.
how hard is it to kind of keep that continuous monitoring happening in the practice? Like what needs to happen over time? You just need to have some kind of a system to stay on top of that?
I'm not going to put it in a box of compliance, like okay, now is your, implicit bias training, or now's your CPR training.
Yeah.
And I don't mind to do that if you need to, right? Because when we're developing a skill, when we're learning something new, in order to systematize it and make it automatic, that's okay for a while. And then you will organically, be able to find other areas, whether it's your interviewing process, whether it's your policies that you have, specifically working with a practice, and it's time, right? Everyone has a different view of time. And so you may be a leader, has a certain view of time that you want everyone there at a certain time. And if they're 1 or 2 minutes late, they're not going to get that bonus for that period of time. So it says that week or a pay period. And you're coming from pure intent. You want to serve your patients. That's your centric view of the world, is from a time perspective. You have a car that works. You keep your car very clean. Your car is always there, ready to go in the garage. If you again, and so these are levels of privilege that some of your team members may not have equal access to, right? They may need to share a car. They may only have one car in that household. They may need to use public transportation. So they're a great fit. And I'm not talking about the extremes, but it's just that team member or team members may need to have a little bit more of a leeway, from a 5 to a 10 minute leeway, or 3 to a 5 minute, because they do not have that access that you have just to drive directly to work.
Yeah.
So walking through that and realizing that and expanding that policy a little bit, now your team member is maybe 2 minutes late, but she still gets her bonus. So that's going to reinforce her retention, not being frustrated because those things are out of her control. And
Yeah.
this was a her in this situation. So if that makes sense. So those are just like little tweaks and changes that you can kind of take a look at from a policy standpoint, and then just write them out like a standard operating procedure, like everything else, and review those on a, put in your calendar. Okay, let's look at review some of our policies, that type of thing.
Yeah, no, I think that's a great example. How do you know if there's biases against certain types of patients? Can you help figure out, like, I don't know, map that out for a practice that's just trying to survive, I guess, in with their culture and with their patient base?
Yeah, I mean, I think what we can look at a couple of things. So first of all, team members know, if you're a certain demographic and you know that whether or not more patients are like you, they're coming into the practice, right? So that's going to be number one. Your marketing could be saying something as well. How inclusive are you with your community members and your community patients? When you're looking at your branding, when you're looking at your website, what are you reflecting? What are you reflecting out there? And I'm not just thinking, the colors or the graphics, but the images and the pictures and your wording, and what are you sharing about yourself or not sharing about yourself. And again, none of this is right or wrong, because we all can run our businesses however we want.
Yeah.
But from a biasing standpoint, it really comes up, like I mentioned before, in what we think our ideal patient is, and not going outside different patient populations. I mean, there was the welfare queen. There was such a stigma when I first started working in dentistry, that people didn't want to have anyone coming into their practice on Medicaid or Medicare, or unless they were had the third party insurances and things like that. Well, that's not necessarily something that we should always stick to. We need to kind of look at different populations. And I know some of you, there's a lot to these layers. All right, so this is just
Sure.
in general. So if you're feeling triggered, or you want to prove me wrong in any type of situation, that's again, that's a learning curve for you, right? That's something inside, you kind of have to peel that back. Why would you have that reaction to this? But so definitely from a patient standpoint, and we can see in the literature that when we've and if you I'm going to say this, if you have not been able to come to grips with, for me being white, my white privilege, and I've had a different lived experience in dentistry and outside of dentistry in this United States. That's step one. So I have to be able to realize that I have been, I didn't create racism. I didn't create negativity against any type of other nationality coming into the country, but I was ingrained. It's the water that we're swimming in. So we just have to take a step back and say, am I offering, and this is the case where I'm going from the research, that there was in dentistry, 12 cases. So it was a small study with, or 20, I think it was 28 providers. And there was a picture of the patient and all the symptoms. So it was a diagnosis, excuse me, all the assessment. And the provider, the doctor, provider, and she, they were supposed to come up with a diagnosis of
Okay.
what, from treatment planning based on all this assessment. And what they found at the end was the Black patients got more recommendations in their treatment plan for extractions than the white patients did. The white patients got more, root canal therapy and crowns. So that just in itself, and again, no one's good or bad, but just having that awareness. Am I presenting the same amount of treatment for these patients, not diagnosing their pocketbook, not diagnosing their insurance company, not diagnosing their zip code? I've heard that, that some people may offer certain treatment options because they know where they live, right? Or may know where they drive. And then they may not do that same type of treatment option for other patients in their practice. So, and those are very hard conversations to have. And I really honor and value the clients who can get down to that level and say,
Yeah.
oh my gosh, I did do that, or I didn't hire that person because I didn't think she was professional enough, but yet that was my version of professionalism, not she was absolutely fine, so just having those conversations and peeling those back a little bit.
Well, I think one thing you're doing today is opening the eye of people thinking, do we do this in our practice, right? They're thinking, they're looking at their practices, their process, the things that they do on a daily basis. And I think it's good to be aware and to think through those things. Here we are in 2024, which is it's a good time to just be open to everyone and love everyone. And I just kind of feel like people have the same needs no matter where you go. We all need water and food, and we all need to be loved, and we all want the same things pretty much, basically, when it comes to basic things. Like you say, we're all different in that we are raised with certain biases, right? But at the same time, we all have all the same needs. Can you think of any
What
story?
we
Go ahead.
I'm sorry. No, I was just going to say, because we do, and that's because I've also heard this. Well, if someone says I don't see color, or I treat everyone the same, and so those languages can be problematic because I don't want to be treated the same. I want to be seen. I want to be heard. I want to know my voice is contributing to the organization or the practice that I'm working in. So it's kind of, again, it's moving yourself away from being ethnocentric, that it's your view and that culture and people are static and this is how it used to be.
Yeah.
And again, I used to teach this. I used to teach, okay, no, leave your life at the door or leave your feelings at the doors. It's stage time. You're on stage now, right? You're coming into the dental practice.
Yeah.
And it's just when I look back at the things I would say, I'm like, oh my gosh, I was not encouraging anyone to bring their full selves to work.
Yeah.
And so, yeah, so you may not care, but your team probably does. And that's why you'd want it from a leadership standpoint, just to kind of look into that. And these new docs, the new graduates, they're being exposed to all of this in dental school. So if you're looking to get associates, to keep associates, to retain them, then we have to match what we're learning and how we're evolving in private practice with what, that the schools are introducing them to and coming into professionalism.
Yeah, for sure. So, do you have any stories from like dental practices that you may have helped or that have implemented some type of training when it comes to biases in their practice?
Yeah, I mean, I mentioned a couple of them before, looking at policies. So that's usually the easiest, and it can be a great way just to kind of step into these conversations, right? And so that is something that you can look at as far as well from the time. So that one particular, actually, there was two employees that ended up affecting, and they're still working there, and they were so happy because when I did the pulse questions, when they did their climate survey, those type of things came up all the time. That their bonus system wasn't fair for A, B, C, and D reasons, right? So that was a success because now that team is still whole and they felt like they were heard. And that's the challenge too. And I'm just going to say, when you do something like this, if you choose to, do something with the results, right? Not just send them a survey and then not talk about it again.
Yeah.
So we have a lot with working with from a policy standpoint, a lot, like I said, a lot of work with retention, just it's not even reinventing, it's maybe just upskilling and tweaking some of the job descriptions, where you're looking for candidates, and then how you're interviewing them. Because, I mean, team members, and especially certain generations, they're just going to ghost you if they felt offended when they walked in the office, if they didn't feel like they were included. So how can we make our future team members feel more included? And then again, as well as our patients as well. So things like that.
I love it. I love it. So let's talk about some resources available to help dental professionals learn more about, how just any ways they can be educated when it comes to implicit bias.
No, for sure. So there's a couple of, I mean, as my mother would say, use the Google, right? So it is a great resource to be able just to get some preliminary information around. And then what you can also do from specifically in dental, and I grabbed two resources because I wanted to make sure I got them right. There is this book that it was introduced to me. You're not gonna be able to see it, but it's called Cultures of Oral Health: Discourse, Practices, and Theory. So it's all about how different biases show up, what we can do from a discrimination standpoint, and some big, as well as some solutions as well. So it's a book, but it's each independent chapter or study, so you don't have to necessarily sit down and read the whole thing to pick up some of the information. And so you have to purchase this one, but this is a free source, the Journal of from Public Health Dentistry. It was 2020 spring, and again, you can Google it. And you can just download that whole edition, and it has a wealth of information on the topics that I've been diving into more in the past couple years, that about an implicit bias, about discrimination, about how we treat each other in a practice, and experiences of dental students and dental hygiene students and things like that. So those are probably the best couple of resources to begin your journey. Email me. I'm very easy to get a hold of. And I can certainly send you over more lists and things like that, depending on, again, it's really depending on what topic you're interested in.
Uh,
And so just from an implicit bias standpoint, implicit bias generally in healthcare, self-reflection, then it goes into the whole change management, right? And how do you operate, how do you create systems out of it? So you can go into little rabbit holes. So it's really what gets your juices flowing. So.
well, and you go into practices and help them with this type of information. So how's the best way to get a hold of you if a practice would like some help from you and your team to come
Yeah.
in and just do some educating?
Yeah. Um, well, first of all, I want to refer them back to the course that we did together.
Oh, yeah.
Um, because that would be, it's a foundational preliminary course. It will get you high level content that, again, you can dig into depending a little bit more. That would be a great course to watch individually or as a team, because there are built-in reflection exercises and activities within that hour. So I would have to say that that's an evidence-based way to begin looking at implicit bias. For me,
That's
myself,
great. Chris.
easiest is my email address. It's Coach Kristine, so it's COACH, Kristine, KRISTINE, Berry, BERRY @gmail.com. That's probably the easiest way to get a hold of me. I'm on Facebook, I'm on LinkedIn. So yeah, you can reach out. And Jacqueline, I mean, they can reach out to you as well. You can get a hold of me as well.
Absolutely. I would direct anyone to you, especially when it comes to cultural questions, anything on biases and cultural, you are the person. So just so everyone knows, the course that Kristine was talking about is called Creating Inclusive Smiles, Recognizing and Addressing Implicit Bias in Dentistry. And it can be found on my website called dentalzing.com, DENTALZING.com. We have a lot of CE courses on there. We do offer CE for her course. Was it a 1 hour course? I was trying to remember. I think it's
No,
a,
it was a 1 hour course, and it's beautiful now because there's 3 to 5 states that are requiring implicit bias training or cultural competency training for license renewal. So that can also help support that as well.
oh, that's
If you're in
huge.
one of those states, yeah.
Yeah, that's huge. I love that. Well, and also Kristine, you can find her at her website, which is Dental Diversity and Inclusion Alliance.com. So if you just even do a search for dental diversity, even in, it'll pop up. That's how I found her website. So I love that. And again, do you want to tell them your email address one more time just to make sure they get it?
Yes, absolutely. So it's Coach Kristine Berry at gmail.com. And it's
Okay,
Kristine with a K and it's Berry. And like I said, we can hook up on LinkedIn or Facebook and you can just send me an email as well. Any
perfect.
questions? Because this is it's such needed work in dentistry, but it's not always easy work. So I'm definitely want to be here.
Yeah. Yeah. Well, I love that. And I will add that into the show notes as well so people can get a hold of you. So that's what we have today for you on our episode of Growing Your Dental Business podcast. Thank you for tuning in. This podcast is sponsored by eAssist Dental Solutions, which is a third-party dental billing company. Please visit dentalbilling.com to learn more about how eAssist can help you with your revenue cycle management. Please like and share this podcast with your friends. We honestly are trying to continue to grow the podcast. Keep smiling. And thank you again for joining us, Kristine. And we'll see everyone next time.